The third presenter is Professor Xiao from Xi'an Jiaotong University, who's going to be talking about modeling COVID-19 pandemic in mainland China. Professor Xiao is a full professor in the School of Mathematics and Statistics at Xi'an Jiaotong University, Xi'an, China, the director of the Interdisciplinary Research Center of Mathematics and Life Sciences. Dr. Xiao has collaborated with China CDC on modeling HIV/AIDS infection as a principal investigator of the sub-project of National Mega Project of Science Research. She has served as principal investigator for several NSFC grants, including a key program. Her research focuses on modeling the infectious disease at multi-scale levels, predicting and assessing the efficacy of interventions and providing the basis for decision makers. Thank you, Professor Xiao.
Thanks, Sarah, for this brief introduction, and also thanks the organizer. And it is my great honor to present our work. Actually, the work, serious work, is joint work with Professor Jiang Hongwu and his team in York University, and Professor Tang and his team in Shanxi Normal University. Firstly, I will introduce our work on COVID-19 pandemic in the following aspect. Actually, with development of COVID-19 pandemic in mainland China, we initially did the early or long-term prediction and then analyze the effect of limitation of medical resources on outbreak. And then we say the possibility of lifting travel restriction on another outbreak. And finally, we will did some work on co-evolution of transmission dynamics and behavior changes. Actually, with during the very early COVID-19 pandemic in mainland China, especially before the lockdown of Wuhan, we use very limited data to make the prediction of basic reproduction number R0 by using two methods, which is model-based estimation and likelihood-based estimation. And we just get the early warning of high transmission risk. And also based on this very limited data, especially before the January 23rd, the lockdown of Wuhan, we predict the development of the infections. And also you can see this prediction of confirmed cases, which is consistent with real data. And also we analyze the effect of lockdown of Wuhan on the infections of other places. And also we take Beijing as example to illustrate it. And we obtained the traffic restriction can make the number of cumulative individuals in 7 days decreased by 75%, which is published in Infectious Disease Modeling 2020. And with development of pandemic, we got multiple sources data, including confirmed cases, the number of deaths, the number of quarantine and isolated individuals, and especially the number of suspected cases. And also we just formulate these rate functions to represent the enhanced control measures. So we coupled these time-dependent rate functions to our dynamic model. And this model can describe the interventions of contact tracing, quarantine, and isolations. And by fitting this dynamic model to the multiple sources data, we can make the long-term predictions, especially the inflection point and the final size and the number of death cases. You can see this just agree well with real data, which is published in Internal Journal of Infectious Disease. And also with the development of a pandemic, we can analyze the effect of limitation of medical resources on infections. And you will know, and also we can, from the Professor Zhou, Huaiping Zhou's talk, in mainland China in 2020, Wuhan, there are lots of Fangcang shelters were made at that time. So firstly, we model the evolving number of beds by the logical growth model, and which model can be parameterized with using this real data. And then we can get the solution of this model, and which can be coupled to this dynamic model. And we can define this function, the daily potential number of beds available for the individuals who currently seek for the hospitalization. And this function equals 0, represents the occurrence of run of medical resources. So use this, we can predict the timing and the duration of such run for various countries, especially for China, Italy, Spain, and Iran. Especially for Iran, we can see this run of medical resources always happen, especially if we improving the growth rate or capacity of this hospital beds. And for with the pandemic becomes weaker in mainland China, so we would like to examine the possibility of lifting travel restriction. We can analyze this by integrating the effect of massive movements on the another or secondary outbreaks. Basically, we use two methods. One is to formulate the model, a determinist model or stochastic model to analyze the effect of movements on possible outbreaks. And also another method, we can seek the optimal reopening strategies by using optimal control method to see where and when the travel restriction can be lifted. So for the reopening strategies within Hubei province, we can formulate the contact network model to see whether the effect of movement among the 16 cities on the outbreak. So our results show that the resumption of work in Hubei province should not be earlier than March 2nd, 2020. Otherwise, the epidemic may break out again. And if the resumption started March 2nd, together with a strong prevention and control strategies, the epidemic will not break out. So, and this result is consistent with actual situations. And for the reopening strategy for Shaanxi province, we just formulated the discrete model with stochastic input because there's relatively few cases. And then we can simulate this discrete model and get that intermittent inflow mode may induce small outbreaks and a relatively good choice for this reception of work, and which is can suggest the policy of orderly peak shifting to resume work and productions. And for the optimal reopening strategy, we basically initial formulate the movement network based on this gravity model, and based on this network, we can define the diffusion distance. By this diffusion distance, we can obtain the result, show the shorter diffusion distance to Wuhan, the earlier the confirmed cases appeared. You can see from this map. And also we formulate the very general reaction diffusion equations to examine, to ensure the non-occurrence of another outbreak, that is these equations and equalities. And by discretizing, we can obtain this 0-1 programming and then get when or where the strict travel restriction can be lifted. And also we can get the net flow matrix among these cities.
Professor Xiao, I just want to interrupt for a moment. Apologies. We have actually reached the end of our session timing. Unfortunately, we're running a little bit over time. So if you might be able to conclude, and I would just like to ask people, if you do have questions, I think I'm just going to offer that maybe Professor Xiao and Zach McCarthy might be able to answer some of them on the chat when we move into the next session. And if you just want to wrap up, apologies, because I know we just missed a bit of time from the beginning there, but please continue. Thank you.
Okay, just to go to the conclusions. So this current project, we would like to get the optimal strategy for coordinating infection control and social activities. And also finally, I would like to say we want to further enhance the collaborations, especially with collaboration with Canadian scientists. We can get the data and the method sharing and exchange of researches. Okay, thank you.
Thank you so much, Professor Xiao. I